My name is Pavan Singera, and the following information is for Foundation of Paramedic Science. Differences in the ambulance services across Australia's states are significant, from the way they approach a scene to how they are taught and studied in universities. However, there are also many similarities between all states in work ethic and everyday practices. Today I will be discussing the differences and similarities between Queensland ambulance services and Victoria's ambulance services. The similarities and differences discussed today will be operational structure, type of paramedics in both states, training and internships undertaken, registration requirements, mandatory requirements, and all assessments taken for applicants to apply as a paramedic. The operational structure for Victoria and Queensland is all different and have no similarities. The difference is in how they work and report all incidents and how they get jobs called in. It is an entirely different process. In Victoria, they have promotion programs, research partners, funding and further development for paramedics for ongoing training to keep all paramedics up to date. For Queensland, it is who provides the jobs, response and pre-hospital caring for all patients to help hospitals with informations, standby at events, air services, pre-disaster and event planning for all safety. The similarities between the two states in the type of paramedics are fairly similar, even though the job titles are different. Graduate and qualified paramedics in Queensland are also in Victoria. Queensland has medical dispatchers, patient transport officers, emergency medical dispatchers, as well as volunteers. Where in Victoria they are called air ambulance officers, ambulance community officers, volunteers, and MICA, referring to Mobile Intense Care Unit officers. The difference: Victoria has a bicycle response team to get to places an ambulance cannot, clinical instructors, team and group managers, and community support coordinators, and Queensland have supervisory recruitment teams. Graduate training or internships undertaken if employed have no similarities. However, the differences are, in Victoria, the paramedics receive 1 to 2 years of training to be familiar with all protocols and procedures, where in Queensland there are two paths. Path A is a 12-month temporary contract, and Path B is also a 12-month contract. However, you can apply for permanent vacancies statewide. Registration requirements for both Queensland and Victoria are both similar. They both require recognition and complete qualification for an ambulance practice assessment. Mandatory requirements. Mandatory requirements have many requirements and are also very similar. Are mostly all similar. The differences between the both mandatory requirements in Victoria: you must have volunteer departure package, declaration and university consent. And in Queensland, to show enrolment and results and a manual driver's license. The similarities are Australian or New Zealand citizenship, which will show your ability to work in the field, a full driver's license, police check and a criminal check, proof of study, personal details including birth certificate, passport and citizenship, all employment to volunteer history, referees and all references must be provided. Assessment undertaken to gain employment. In both states have differences and some similarities. The differences are that all in Victoria applicants are ranked in order of merit, and in Queensland all applicants have to do a medical assessment and also sit an English language test. However, the similarities are all applicants receive and are recognised, numerical testing and verbal tests are also done, as well as medical and physical assessments are held, panel interviews. After all these positions are offered to those in Victoria receive contracts, and in Queensland, Pathway A or Pathway B is offered as a job for the future. Thank you.